Can you see me properly?
Yes, perfect. I was about to scream out that you have such a stash of books.
Well, it's the background.
That was why I said I was about to scream out, like, how do you get the time to read so much? But it's lovely. All
Thank you.
right, we'll go in. We're live on YouTube, by the way.
Okay.
Love music, love life, love the sisters, and there is a huge space for them here that they always will feel, especially if they reserve their names. Now, this is the show that talks about women every Wednesday from 11 till 11:50. So we crush on women, but we don't just crush on women, we also talk about them and what is good for them in every aspect, physically, mentally, emotionally, psychologically, health-wise, every from the spirit, soul, and body, we have discussions from time to time that caters to that. And then we also give updates about what's happening with women all around the world. We give you the news, and on some days, we are also talking about some personal development information for them and everything really. And special shout out to all the women who come through sometimes in the background and send messages later. And we must say a huge shout out to all the soul brothers who are always a part of the show. I know that at least one soul brother is going to send a message. And that is right, because women do not exist in isolation. And this information that we share also will help to better the relationship that we have with one another. You have a better understanding of the woman and how you can be of help in any way. So thank you, dear men, that support the women in all the ways that you can. Now, if you're a part of our WhatsApp family, you would have seen the status where we share the flyer that we're going to be talking about polycystic ovary syndrome this morning. And if you're following us across all socials, you would have seen that as well. And I cannot wait to get into the conversation because it's something that I promise you will be enlightening. You will get to understand why some things are the way they are. And even though science seems not to have the understanding and why some things are happening, so today we will be uncovering, okay, maybe more like understanding polycystic ovary syndrome, the causes, the symptoms, the treatment options available. In the course of this conversation, you're welcome to ask any question that you feel will help your knowledge. I have someone who is very experienced and we answer all your questions. I think she's the Google of today. And you can join us on YouTube and see her face. She's joining us all the way from many continents away. And you will see us on YouTube at Smooth 981 FM Lagos. At Smooth 981 FM Lagos. My name is Oluwaseun Olusegun. And my guest is a United Kingdom based general practitioner and family medicine consultant with over a decade of clinical experience. She has a special interest in women's health, sexual and reproductive health, and menopause, as well as a background in general internal medicine, including dermatology, diabetes, endocrinology, and oncology. She's a member of many associations, and that includes Royal College of General Practitioners. You have Royal College of Physicians, as well as the British Menopause Society and the Primary Care Women's Health Forum. And not to leave out the fact that she's an author as well. So please welcome with me Dr. Itunu Johnson-Sogbetun, popularly and fondly known as Dr. Showcase. Good morning.
Morning. Hello. It's so nice to be back in the studio with you, Cheryl. So lovely to see you. And thank you for that fantastic introduction.
Thank you. I do appreciate you taking time out of your schedule this morning to be with us and also educate us on the matter of polycystic ovary syndrome. Now, right into the discussion, understanding what exactly this thing is, because according to data, it affects almost in one particular study, up to 70% of women with polycystic ovary syndrome have not been diagnosed yet. So it means that it's possibly there, but the symptoms are not even showing. And it affects women during childbearing years. And I am just curious about what causes this thing. But first, we need to know what it is and how it manifests. So, what is polycystic ovary syndrome?
Absolutely. So it's first and foremost a hormonal disorder, but it's also a metabolic disorder. And that means it actually, even though we all think about it as something that only affects the reproductive organs, it actually affects the whole body. So it's a hormonal and metabolic disorder that affects women of reproductive age, as you said, but the impacts can affect a woman for the entirety of her life.
Yeah.
In particular, the metabolic aspects to it. And we'll come to talk about that in a little while. So it's characterized by irregular periods, high levels of male hormones, so also known as androgens, and that this leads to certain symptoms like excessive hair, hair in the wrong places, and cysts on the ovaries. Now, you need two out of those three to get a formal diagnosis of polycystic ovarian syndrome. So it is possible to have polycystic ovarian syndrome and actually not have those cysts on your ovaries, which kind of makes the name a slight misnomer. And it is one of the most common endocrine disorders that affects women, with up to 10% of women worldwide. And what you just said about a lot of women not having a diagnosis, many women may have it and not realize because they don't get any symptoms and they don't recognize it.
Hmm.
And, maybe that's not too much of an issue if it's not causing them any problems.
Oh, okay. Now I'm curious to know why some get the symptoms and others don't. Is there something that causes or affects that or determines it?
So it's interesting because I've actually lived with polycystic ovarian syndrome my entire life. When I say my entire life, since I was a teenager. And how it was diagnosed with me wasn't because I had any symptoms at that time when I was about 18 years old. It was just noted on a scan that I had cysts on my ovaries. And so like many women, that's how a lot of women find out. They have an ultrasound and then they have noted to have cysts, and then someone does a blood test and they say, okay, you've got polycystic ovarian syndrome. The exact cause is unknown. And I think that's a bit confusing for a lot of women because you're like, why do I have it? And there's genetics, it often runs in families, so that's important to know. But also it has to do with insulin resistance. And this is where the metabolic impact really comes in because insulin is obviously the hormone that helps reduce sugar from what we eat in the body. Um, and of course, in the blood, sorry. And of course, if you've got insulin resistance and the insulin is not working, then it then causes a lot of problems, increasing risk of diabetes and other health problems later on in life. And then the hormonal imbalance. So we talked about the excessive male hormone, which can then cause symptoms, but also can disrupt ovulation, which is what some women will notice is that they have irregular periods. So they go months with no periods. And that obviously then becomes a problem, which can impact fertility. And finally, lifestyle factors. So we say with even if you've got sort of a polycystic ovarian syndrome, you may have no symptoms and then you suddenly gain weight and all of a sudden you get symptoms. And that's the issue, is that being overweight can make the symptoms worse. But conversely, PCOS can make it more difficult to lose weight. So it becomes a horrible catch-22. And I understand this very well myself, with the challenges with weight gain that can occur. But poor diet, so eating badly, and not having any physical activity can also make the symptoms worse.
Wow, that's a lot that I'm trying to unpack. So, for the sake of someone who has heard lots of medical jargons and wants to understand, so I'm going to take it one step at a time. So, let's say a woman of childbearing age exists, she's going through life normally, and all of a sudden, she develops insulin resistance for whatever reasons. That then becomes a risk factor for PCOS.
Well, it's more like if she has underlying PCOS, then she probably will then develop insulin resistance, particularly if she gains weight. But there's other factors as well, like stress. We underestimate the impact of stress on our bodies. So say, for example, I had PCOS from 18, but I had regular periods. It was only at a point in time when I developed quite significant stress in my life that I then started getting the symptoms of irregular periods and then started having some of the challenges with the insulin resistance issues. So again, with a healthy lifestyle, you may not get any symptoms, but that's not to say that some women who have a healthy diet, have no stress, don't have symptoms. And a lot of that will then be related to the genetics, the underlying genetics of why they may have it.
Hmm. Okay, I think it's getting clear. So let's say someone who has gotten it from the ancestors, for the lack of a better word, it's resting there. Then something happens like stress, it triggers the symptoms, right? It can trigger the symptoms.
So something happens like, so some women will just from like, as soon as they start having their periods, will note that they've got irregular periods and they may have the symptoms straight off the bat. And that does happen. Some women will then develop the symptoms later on in life, maybe because they've gained weight or because of stress or because they have a bad lifestyle, so eating poorly and not doing any exercise. So it's
Mm.
very variable. And I think it's important to understand that, like, as Black women, we are at higher risk of manifesting the symptoms, particularly because there's a really high level of being overweight amongst Black women, particularly in I will say in the diaspora, but that's now also becoming more of an issue as well in sort of urban areas of Africa, like in Nigeria, in the big cities. Many women, don't have the energy or time to do exercise. Many women, just eat what they can see, maybe not necessarily taking that time to think about what they're putting in their bodies because they're really busy with looking after children, with working, with
Mm.
supporting the family. And all of that then means that these things can manifest.
Whoa. I'm looking at the aspect of weight, especially as weight gain and weight loss, especially as I have seen so many. I don't know if I should call them myths right now, because if she needs to lose weight for the symptoms to be better and for her to be better, right? And the particular disruption in the hormone makes it harder to lose weight. So how does she go about it? Okay, maybe I'm already going into the treatment options, but I just wanted to quickly touch on that one.
It's really hard. I understand this myself. So you need to do all you can do to optimize what you're eating. So, for example, portion control. So many of us, I grew up in Nigeria myself. The portion sizes of the carbohydrates that we eat is usually far more than we need. We often just need a fist-size amount of the carbohydrates. So that's whether it's rice or eba or yam, or pounded yam or yam. We don't need more than a fist size. And then we should be eating protein and vegetables in every meal. That's kind of how we should be having a balanced, healthy diet. But often we're eating, mounds of carbohydrates. And the carbohydrates then turn into sugar, which worsen the insulin resistance picture. So if we can make those changes to reducing sort of the portion sizes, but also eating healthier carbohydrates. So like instead of white rice, eat brown rice, but still the portion sizes have to be better. Instead of eating white bread, we may eat brown bread, similar with pasta. So we can make those changes because the whole wheat is less easily converted into sugar in the way that the white version would be. So all of those things can help, but also movement. And I know that for a lot of women, we've already talked about the challenges around how to move, because for a lot of people, they just don't have the time or they don't feel like they have the resources. But actually, just trying to incorporate movement into your day-to-day lives, like, in your commute, trying to sit less at work, just get up every sort of half an hour, even if it's just to sit and stand, sit and stand, sit and stand. It's really about increasing movement. You don't necessarily have to go to the gym to be like, I'm exercising. Obviously, for some people that works. Sometimes it's even, running after the kids, like going to the playground, like just getting involved. Sometimes it's team sports. Maybe you can get involved in some kind of like whatever, golf or basketball or tennis or whatever you enjoy. Now, I know that some of these things are are difficult. Dancing, even, you don't have to spend any money to dance. So movement can help. But for some women, they will do all this stuff, moving, eating healthily, and they're still struggling. And thankfully, now there's some new medications that can really help. So they're called GLP-1 agonists. Some of you might have heard of Ozempic. But it's actually Wegovy and Mounjaro. So sometimes if one is really obese, so with a BMI over 30, although we don't really like to use BMI, but it's what we have, because BMI is not really that accurate for people of color like ourselves, but it's kind of what we have. But if your weight is excessive and you're really doing all you can, sometimes these medications can help with reducing that.
Thank you for that very lucid explanation. Now, I still have more questions like is it hirsutism now, the excessive hair growth? And that is something I see when you look at the chronicles of people going through or people with PCOS online, that is one of the battles and how some of them are shamed for the body hair or the facial hair. So I want to talk a little about that, but that will be right after this. If you're joining us for the first time, you are listening to Soul Sisters right here on Smooth 98.1. Just some seconds, please. Back like I never left. So we talk about that and we go on with the conversation. I'm enjoying the flow of this.
Soul Sisters, a discourse on Smooth 98.1.
Love music, love life. You are listening to Soul Sisters on Smooth 98.1. It's 19 minutes past 11 o'clock, 22nd of January, 2025. We're talking about polycystic ovary syndrome, and you can join us on YouTube as well as on WhatsApp. That's if you have any question. So the YouTube channel that we are streaming live to is at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. If you'd like to use that option to drop your questions or contribution or comments, then it's okay to use the live chat option. But if you want to come to WhatsApp, 0809 444 0981. Again, 0809 444 0981. My guest is a UK-based general practitioner and family medicine consultant with special interest in women's health, sexual and reproductive health, as well as menopause. And we are now about to understand the excessive hair growth on the bodies of women dealing with PCOS. The first question is, will everyone that is experiencing the symptoms of PCOS have this excessive hair control or growth?
It's common. So it's very common in women who are symptomatic. And it's actually as a result of those excessive male hormones. You remember the androgens that I spoke about, which is part of the hormonal imbalance that is a feature of polycystic ovarian syndrome. So a lot of the time people would have hair on the chin or the chest. And this can be very difficult for women, because they might find that they're feeling self-conscious about it. And that, and like it can be a problem. But it's not the only symptom that women might get, for example, because we already talked about the irregular or missed periods, but women may also experience acne. And that again is tied in with this excessive male hormone. So they might have acne on the face and the back and the chest, oily skin, even dandruff and skin problems on the scalp. We already talked about weight gain or difficulty losing weight. The other thing that women can experience is thinning hair, particularly in this area, which is kind of like a male pattern, which again has to do with the excessive androgens. And with the missed periods that women are getting, if they're not ovulating, then they may have difficulty getting pregnant. And some women have problems with hyperpigmentation of the skin. So these are all common symptoms, and all of that is related to the hormonal imbalance and the insulin resistance that we've spoken about.
So this looks to me like if you're going to deal with you can't just deal with the hair, excessive hair growth. You would have to go to the root of it, which is the hormonal imbalance.
Absolutely. Which, of course, when we're talking about treatment options, then we can discuss what is possible. Now, yeah. So I don't want to jump ahead too much. So
Before we get to the treatment options, is it I want to know the diagnosis. And before you say, yes, this person has got polycystic ovarian syndrome, is it until you go for the scan, or are there, other than the scan, are there other things that will tell you that this person has it? Because I don't think it's everyone who has the excessive hair growth and the likes that is battling with PCOS.
Yeah, because some people just have naturally excessive hair growth and it's not PCOS. So effectively, as I said, there's three things that are kind of features, and you have to have 2 out of 3 to get a diagnosis of PCOS. And the three things are: one, the irregular and missed periods, which is obviously something that the woman is going to report. 2 is the hormonal excessive male hormone symptoms, or on the blood test showing excessive male hormone symptoms. So for example, if a woman has irregular missed periods and the excessive hair or acne and that kind of thing, then she has PCOS. But if a woman doesn't have the excessive hair and she has high levels of male hormone on her blood test, then again, she has PCOS, even without having done the scan. But we would normally try and do the scan for completion because that helps confirm the diagnosis. But as I said repeatedly, the third criteria is having the cysts on the scan. But I said repeatedly, it is possible to have a diagnosis of PCOS without having the cysts on the scan or without having cysts.
So if a lady is worried, she has maybe 2 out of 3, and she decides, I want to go for a test, what test should she be looking at, and how accessible this, I don't know, test services or tests?
So, I mean, they're not particularly challenging tests. Obviously, in Nigeria, there's not free healthcare, so people have to pay for things, which can then make it more challenging for them to be able to access care. So effectively, you need a blood test, and that blood test will be looking at your hormone levels, as well as I would normally do things like checking for the metabolic issues. So things like I would do diabetes tests, so HbA1c and cholesterol, and I would also take blood pressure, so to look for other kind of metabolic factors that may be impacted, as well as, but that's not part of the diagnosis, that's just part of the assessment. The main diagnostic tests are the hormonal tests, looking at the male hormone levels, FSH, LH, and looking at the male hormone levels, which is testosterone and SHBG, to see if those are elevated and if there's an abnormality in the FSH-LH ratio. And then, so these are hormones that the body produces. And then the scan is helpful to see, are there cysts? So that's what we would normally do in order to get the diagnosis.
Thank you. Now let's talk about some myths about it. I want to assume that there would have been many wrongly held conceptions or perceptions of PCOS that you would have come across. I mean, I know one, and it's about how the excessive hair growth and how you can never be rid of it. And I was just shocked because how this happened was someone, so I saw a video of somebody chronicling an experience with PCOS online, and some really mean comments in the comment section. So, which I believe stems from inadequate knowledge about the topic. So, in your experience and your advocacy on this and education about PCOS, what are some of the commonly held myths about PCOS?
I think one big one is that PCOS always causes infertility. And that's not true. It can increase your chance of having infertility, but if you're having regular periods and you're ovulating every month, then there's every good chance that you're going to conceive, provided there's no other issues. So PCOS doesn't always cause infertility, but even if women are struggling to ovulate, there's treatment to help them ovulate and conceive. So many women will conceive with fertility treatment, which, there's a whole range of fertility treatments and of course, including IVF. But again, even just losing weight can mean that the ovulation restarts. And there's even some really natural supplements like folic alpha that can be used, and that can also help restore ovulation. So I think that's something to be aware of. So women shouldn't feel scared of, because in sort of in African culture, it's like, you know, it's not true. That is not true. So women can conceive even if they've got PCOS, but that doesn't mean that some women don't struggle. And of course, I acknowledge that that can be really painful. There's a small percentage of women who, even with treatment, might still struggle. And that can be very difficult to manage. I think a really common one as well is that only overweight women get PCOS. Again, this is not true. There's a lot of slim women who have PCOS. Again, it has related to genetics. And so it can obviously be much worse by being overweight, and it can trigger being overweight, but it affects women of all sizes. And the thing is, some people also think it's just a women's health issue. I think that's another myth. As I said to you, it's a whole body issue because it can cause problems with, heart health. It can cause problems with diabetes. And so it's a medical condition. It's not just a women's health issue. It's not just a cosmetic issue. It's actually a proper medical condition that has far-reaching impacts, and it needs to be taken seriously. And women who have it need to be supported to get the best care. And the other thing is, irregular periods are normal in young women. And so just ignore it. That is not true. If a woman is having persistently irregular periods, of course, we all have the odd missed period. That's normal. But if a woman is getting persistently irregular periods, she needs to see a medical professional for discussion.
There is another, I don't know if it's true, that PCOS often causes heavy bleeding during menstruation. Is that true?
So what can happen, and I think this is really important, is that because women have irregular periods during PCOS, basically you can have a period of time with no bleeding, and then you then get a really heavy bleed. And because of that, not having periods for a long time, the womb lining can get really thick. And that means when it finally breaks down, it's a very, very heavy period. And sometimes it can even cause that thickness can increase the risk of womb cancer, which is the reason why you shouldn't go for more than 2-3 months with no period. So you shouldn't go for more than 3 months with no period. You need to see a doctor because that can increase your risk of, getting a thickened lining, and over time that can increase your risk of womb cancer. And that's another thing that is a complication of PCOS, is an increased risk of womb cancer. And also some women with their hormonal imbalance will just be bleeding all the time because their hormones are all over the place and their cycles are so abnormal. So some women have no periods, some women have constant, irregular, just very disruptive bleeding. So you can get either of those outcomes out of PCOS.
Oh, now that takes me back to the story of the woman with the issue of blood. Maybe she had PCOS.
It is very possible. It is very
Oh,
possible.
wow. Oh, wow. That is interesting. Okay, so back to the main comment section. I said, make me ask this question. One of the persons in that comment section said that PCOS will cause fibroids. Is there any truth to this?
No. But of course, as Black women, we're more likely to have fibroids anyways. So both things can concurrently exist, but PCOS did not cause fibroids. It just coincidental. Yeah.
Black women, Black women, Black women.
I know, right?
What? All right, now let's talk about the treatment options available, how the hormone can be stabilized. And I'm also interested in, I think you mentioned a little bit about that, but I want details. The kind of food she should be eating, because again, so many articles online about the diet of the woman dealing with PCOS. Do not eat gluten, do not eat carbohydrate, do not eat this and that. So first, let's talk about the treatment options available, and then we talk about the diets.
Okay, so I would say that diet is a number one treatment option.
Great.
Um, so it's really, really important. Obviously, we can come back to talk about it because I've already started talking about it. But
Yeah, do start.
lifestyle is vital. So eating healthily, moving. I don't like to use the word exercise because it makes people feel like it's something heavy. It's movement, increased movement, and mental load and stress management. I mean, the last time I came on, I know I talked about mental load, which is how much we have in our brains and how much we're doing. If it's so heavy, obviously that's going to impact your lifestyle options and it's going to increase your stress levels, and all of that is going to make everything worse. So we'll come back to the lifestyle stuff, but that is, for me, the most important part of treatment. Now, how things go forward, I think depends on whether one, the symptoms the woman is having, and two, if the woman is trying to conceive or not.
Mm.
So, for example, if a woman is not having any symptoms and she feels fine, then she just needs to carry on with a healthy lifestyle and perhaps nothing is needed, right? So for that category of women, it will just be lifestyle stuff and there's no sort of medication needed. Now, if a woman is symptomatic, so say, for example, getting irregular periods, which is often the most common, or having the excessive hair or all those kind of symptoms, then we've got to think about, do they want to conceive at the moment, or do they not want to conceive at the moment? Now, obviously, that may change in the future, and none of these options should, unless a woman is like, you know what, I'm not interested in conceiving ever, which is usually unlikely for an African woman, but of course there are a few women who have that view, which is perfectly acceptable. But for women who are not trying to conceive at the moment, then a really good treatment option is hormonal treatments. And in particular, they're anti-androgen contraceptive pills. So basically, that will then help regulate the periods. The anti-androgen element, so contraceptive pills, I'm talking about the combined contraceptive pill, which has estrogen and progesterone. So there's a particular type of progesterone that's anti-androgen progesterone, and that's particularly helpful for the male hormone symptoms of the excessive hair and the acne. So we can often recommend those contraceptive pills, and then a woman can then regain having regular periods. Her womb lining is protected. She doesn't have to have the period every month with the contraceptive pill. You can have it once, you can choose to have a bleed once every 3 months. As long as you're on the contraceptive pill, that's absolutely fine. So you can do this thing where you're taking the pill packs back to back for 3 months and then have a bleed. So that's that. And you can also have if you can't have estrogen, you can have the progesterone only pill. Now, there is a new progesterone only pill that's an anti-androgen. Now, it's not licensed for polycystic ovarian syndrome, but they're still doing studies on it. But it may be helpful, particularly because it's the similar anti-androgen that is in many of the combined contraceptive pills. So there's a progesterone only pill called Slind drospirenone. So that's new on the market, but it may be helpful in women with PCOS. Now, the more traditional progesterone only pills, like desogestrel, can be used to help women who are having irregular periods, but it may not cause them to get their periods back, because a good percentage of the women on those progesterone only pills will not have periods. But it's still a lot safer because their womb lining is being protected and kept thin. Because the problem with having no periods for a long period of time is that womb lining can get thickened, and that can increase your risk of womb cancer. And then finally, a really good option is the hormone coil, which you can have in the womb. Again, it's a contraceptive, but it can keep the womb lining thin. For women who are having those constant bleeding, or for women who are having irregular bleeding, is a really good option. Most women will not have bleeding on it, but you know that your womb lining is safe, and it's a good contraceptive option. Now, it may not help with the anti-androgen symptoms, but it's helping with keeping your womb lining safe. Now, of course, for some women, other lifestyle issues are an issue. So like the excessive hair, you might want to do cosmetic treatments, so laser hair removal, creams, and all of that stuff can help. Other acne treatments, so you could, there's loads of different acne treatments that are not necessarily hormonal that can be used as well. Now, metformin is a medication that can be helpful for helping with the insulin resistance. But there's also a natural supplement, I mentioned it earlier, called inofolic alpha. So this any woman can use. It doesn't have any side effects. It's not a medication. It's a supplement. And you can buy that and use it. It doesn't work for everybody, and we're not quite sure why it works for some women and doesn't. But it can help bring periods back. It can help with the weight loss. It can help with regulating the hormones, and so it's something that it's worth a try for at least 3 to 6 months. If it doesn't work, then you can stop it. Now, if you are trying to conceive, in preparation, you could have metformin, not while you're trying to get pregnant, but in preparation to maybe try and help optimize things. But if you haven't been successful, then, treatments for fertility can then be used. So you can go and see a fertility doctor who can give treatments to induce ovulation. And then also IVF can be used as well. I hope that makes sense. But now back to the lifestyle, which is the fundamental. It's about healthy eating. Now, I personally don't advocate any, diets or fads. I think what's really important is healthy eating by doing healthy portions. As I said, no more than a fist size of carbohydrates, proteins, so lots of proteins, lots of vegetables and fruits. You want to try and eat a variety of fruits and vegetables. Some describe it as eating the rainbow, so different colored fruits and vegetables. So not, apples every day. You want to try and eat apples, pears, oranges, pineapples, mangoes. There's so much available in Nigeria that we can eat in terms of fruits and vegetables. Spinach, broccoli, aubergines. There's so many different vegetables, carrots. There's just such a wide variety. Now, with protein, you obviously want to try and eat as lean proteins. So because the red meat increases your risk of cholesterol. So I would say that, try and eat red meat no more than once every 2 weeks, and just eat, if you're not vegetarian, eat lean proteins like fish and chicken. Now, if you are vegetarian, and even if you're not, there's lots of pulses like beans, legumes, lentils, all this kind of really healthy proteins, that can be really helpful. Also healthy fats like avocados, olives, olive oil, using those kind of healthy fats, really trying to avoid cooking with traditional palm oil, which is solid at room temperature. You want to try and use the healthier palm oils, and there's quite a few brands that now have healthier palm oil. So it still gives you the same taste and flavor, but it's a lot healthier in terms of the fat content. And then, of course, movement, which we spoke about, and stress management, which is fundamental.
Yeah, that part is really, really fundamental, like you said. Now, I would want you to talk to the men, especially the ones who see a woman all of a sudden gaining weight, or she gets darker, or she starts to have excessive facial hairs and they don't know what's going on, but they just know something is going on with her, and they say, go lose some weight and go deal with this. Before we get to that, there is a curious one on my mind. Will these symptoms disappear with menopause? I mean, she's done having babies or ovulating now. Will these things go?
So, of course, when a woman is menopausal, she's not having cycles. So, the irregular periods will stop because she's not having periods anyways. Um, and but the ongoing hormonal imbalance and the ongoing I should say the ongoing sequelae, complications of the hormonal imbalance and the ongoing metabolic issues may affect a woman for the rest of her life. So, for example, we haven't talked about the complications of PCOS,
Yeah.
but I mentioned about the increased risk of type 2 diabetes, heart disease, endometrial cancer, and of course, depression and anxiety. All of those things may impact a woman for the rest of her life. And so this is why it's really important to look after your health and try and make sure that you're optimizing your health before you go into menopause. And of course, women who had PCOS remain at higher risk of endometrial cancer. So again, if a woman is postmenopausal and has any bleeding, she needs to be investigated anyways. But with if she had PCOS, then there's a higher chance that she might get womb cancer. So yes, some of the period issues are going away, but women may still find that they still have persistent issues with hair. The acne issues may go away or not. It's very variable, because again, it depends on what the hormones are doing postmenopausally. Because obviously with menopause, you get hormonal dysregulation anyways. And then, but the complications, many of them may still be impactful.
Thank you very much for the educative time and everything that you have shared. And I hope that someone finds this really enlightening and it's going to help. Oluwaseun on WhatsApp, I think you're taking us out of the scope of the quest of the discussion. Maybe, just maybe I will come to this later. But first, I mean, he's asking about ectopic pregnancy. That's why I said he's taking us out of the context of the conversation. So if at all we have any time for this, we need to first have you say something to the men and the women who have no clue what PCOS is, but they see someone dealing with the symptoms, and even the person might not understand what's going on within them. What do you have to say?
So I think it's important to say PCOS doesn't just affect the woman. It impacts her family, her relationships. As I said, some of the the hormonal imbalance can impact her mood. So it's not even just, the hair issues, which can obviously then contribute to depression and anxiety. But again, PCOS itself can cause mood dysregulation. So that can really impact a family. Also, fertility concerns. Women can feel really worried, especially like in African culture, with her partner, with her partner's family, maybe there's pressure and they don't understand what's going on. So I think really being understanding of the physical and emotional challenges is really, really important. And then trying to work as a team on the healthy things, because it makes it much easier. How hard would it be if a woman is trying to eat healthy and the partner is not? And then is she going to have to then make two different meals? It just makes it much harder. So if you can support your partner with eating healthily, or your friend or whoever it is that has the PCOS, even saying, let's do movement together, let's go for walks in the morning together, or at the weekend, let's go swimming, let's do something with movement. So encouraging healthy habits as a team, but also just, encouraging people to, if you're seeing, I think you're really struggling with encourage them to get help for their mental health, and don't make it worse by putting unnecessary pressure. Share the mental load, get involved, get stuck in. Don't leave the woman to do everything in the home, especially if she's working. It's, of course, if she's working at full time in the home, that's different. But if she's working outside the home, don't let her do everything. It's too much. And just be mindful of that, because that stress can impact her symptoms. Because I don't know if I've mentioned it, but 5% weight loss can actually bring back ovulation. So it doesn't always, but it can. So even just 5% weight loss can be really effective. So encouraging those healthy habits can really make a difference. And I think educating ourselves, men, women, friends, family, about PCOS and its effects. So listening to this podcast today and the radio channel, watching it on YouTube, you've done something really fantastic for your friends and family.
And on the final note, what would you say to the woman who's dealing with the symptoms of PCOS?
So I think firstly, you will be okay is the first thing to say. I've lived with PCOS myself. I'm blessed with a beautiful little boy. And yes, I've had health challenges, but I've pushed through. So seek medical advice early. I think it's really important. Don't ignore irregular periods or symptoms. Get medical advice. Healthy lifestyle, as I've mentioned, even small changes, 5% weight loss and physical activity can make a huge difference. So don't think, oh, I've only lost, a little bit of weight, but actually that could make a really big difference. And then be patient. It is manageable with the right approach. You just need to get the right path for yourself. Not everything will work. Sometimes you'll try something, it didn't work, but there's always as long as you keep going and keep going to people who know about the condition, how they can support you, you should be able to get a right approach for your health. So don't give up. And then spread awareness to everyone. This is not just to the women. Let's spread awareness about PCOS and break the stigma around discussing women's health issues. So thank you, Sharon, for bringing me to talk about this, because it's really, really important.
Thank you for giving us your time, and you've gone on for close to 50 minutes, and that is really impressive. Thank you for the education. Thank you for the work that you're doing with women's health. I mean, I see your clips, I see your YouTube channel, your books, everything is geared towards giving more education and ultimately helping the women navigate their health better. So thank you for the work.
Thank you.
Now we are done with this, but we'll be back next week on Soul Sisters on Smooth 98.1, and we'll be talking about another topic. This you can be sure of, that it will be about the women, and it will provide education for all, because as I said at the start of the show, the woman does not exist in the society in isolation. You have sisters, you have mothers, you have wives, you have girlfriends, you have daughters. So you are an important part of this conversation, as the woman is. You can catch up with the conversation on YouTube in case you are just joining us. YouTube is at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. And Dr. Show is Dr. Show across all social media platforms. So what are your
At Dr.
handles?
Show Cares across all media platforms. See DRSHOCARES at Dr. Show Cares.
And Dr. Show really cares. So you might want to follow her and see all that she's about, especially the educative tips that she shares on socials. We're done. And again, thank you. My name is Oluwaseun Olusegun. In 10 minutes' time, I'll be with you on the Casbah, playing you lovely African tunes to make sure that your lunchtime is even more good, right here on Smooth 98.1. Here is Willie Dyson with A Woman Needs to Be Loved. Thank you.
Thank you
It was
so
a great one. Thank
much.
you.
Thank you so much for having me.
I'm going to have you again, maybe in March, and that's Women's Month. So I'm going to have you back in March.
Happy to be there. So just let me know.
I will.
Have a lovely rest of your day.
And you too. So I'll send the link to this video with
Thank
to
you.
you on WhatsApp, just in case you want to have it.
I would really appreciate that. Thank you so much. All right.
Bye.
Bye-bye.